For those of you who don't know me, my name is Dr. Leah Houston. I am the founder of Evercred, and I'm an emergency physician and MIT trained in AI and healthcare. And it's not just me. There were hundreds of physicians who actually made this possible. We all decided that we didn't want to have our profession controlled any longer and that we wanted to own our data. And so we came up with this solution to our broken healthcare system. And I'm going to share a little bit about where we are and where we're going. What most people don't realize, and I think most people in the room realize this, but most people outside of healthcare don't realize that when a doctor wants to work, we go through a 4 to 6 month manual, friction-filled process called credentialing to verify that we're safe to work and care for people. And we have to do this not only once, not only just when we graduate, we have to do it over and over and over again throughout our career. And what most people also don't realize is that it kind of keeps us trapped. It traps us wherever we're working, and it makes it hard for us to work and move freely. And even though credentialing isn't the only problem we as a company want to solve, that's the first problem we're solving because it affects all doctors and all practitioners. And so when you factor in the lost revenue, the errors that come with the mistakes that are made with this manual, handwritten, sometimes on spreadsheets and in Dropboxes, credentialing process, and importantly, the human labor. How many humans actually have to go do this manual stuff? This is a $150 billion problem in our $5.9+ trillion healthcare system. And so it's not only a money and a time problem for hospitals, health systems, telemedicine clinics, urgent cares, private practices. And it's not only a money problem for doctors because we can't earn revenue, we can't earn an income if we're still waiting for credentialing, but this actually affects patients. And so a lot of patients are wondering why it's so hard to see a doctor, to get an appointment, why they feel rushed. And a lot of the foundational reasons is because of this bottleneck called credentialing, because doctors are waiting on the sidelines when they could be seeing patients. And so in reality, this foundational process that touches all of us, not only the doctors, but the patients, it leads to delays in diagnosis, death, and disability. And that's part of why it's so important to fix. At Evercred, we use domain-trained AI agents to extract, verify, and manage a doctor's credentials from graduation to retirement, so that all that busy work, all of that manual stuff is actually going to be done by AI agents. And so, we've been hoping that, AI is going to help us with our administrative processes. And so now is the time that it's actually going to start happening, not only for doctors, but for private practices, credentialing specialists, and the systems. And so we can shorten this credentialing timeline from months to moments. And that's the goal of the company. The goal is workforce mobility, an ability to work, to move freely, to pick up work wherever you want, to open your private practice easily without the administrative burden of credentialing. I'm going to show a quick demo of the actual product. And so if you go to the credentialing wallet, so this is what the credentialing wallet and the dashboard actually looks like. So when you open up your credentialing wallet as a doctor or practitioner, you have this section where you can see how many credentials you have. If you have a note from one of your health systems, you can reply to that note. You have a credentialing wallet where you can upload credentials, browse anything, and essentially the AI will read it, detect it, and then extract the data for you. So nothing needs to be handwritten. When you save this to the wallet, it will be entered here and you can verify it. And so if you look down here, the AI agent is actually verifying the license and they're keeping track of what they're doing. They're going to the website. They're doing the same thing that a human would do. And this is done in moments. You can re-verify, you can look at all of the data and the activity and the details of the credential. And so that's for the practitioner side. And so the thing that's unique about what we're doing is when you're credentialing for one entity, you now can take this data with you if you ever move. So this is yours from graduation into retirement. So we're the first and only company that's actually doing it. As of tomorrow, we are launching our AI agents for all of these states. So California has already been launched, as has Texas. Florida, New York, Hawaii, Connecticut, all of the states listed here are going to be completed, and we're going to complete all 50 state licenses by the end of this month. And so one of the biggest frustrations is keeping track of your licenses, keeping track of the expiration dates, whether you're an actual, practitioner or whether you are an organization. And so this is one of the big things that we're going to be doing, and we're really excited to share it with you guys. No, that's the exciting thing. So from your credential wallet, you can click and share the credentials with anyone you choose. When you share them, every single organization gets access to one packet for free. So part of why I built it that way is because I don't want you to be limited if they are not currently customers. And so if an organization is getting more than one free packet from more than one practitioner, then they need to upgrade. And the price point, I think, is very fair for that upgrade, especially since the agents are essentially going to be covering the cost of the humans. But for that first packet, and from my perspective, the first few thousand doctors that use this, they're going to be able to share their credentials and have their credentials be looked at and managed without anybody paying or upgrading. Yes, and so, if this is your packet and this is the free packet that you've shared with them, the free chance that they've had to open the packet, and they don't want to use Evercred, they can click download right there and download all your credentials. So there's no vendor lock-in for their first try. Now, as a company, we need to eventually make money, and that's why there's only one free packet for everyone. But we presume that once people see this and see it in action, see how much money they can save by using a tool like this, it'll be a no-brainer because, the system essentially covers the cost of itself after only one credentialing cycle. That's what we're projecting. Yes, DEA is also already done. So DEA, Controlled Substance Database, we're going to be integrating CAQH, FSMB, ABMS. We're going to be doing all of that. That's going to be happening hopefully in the next few months. We're going to be slowly rolling that out. We're really focused on getting the states done first and the state coverage map. But yeah, we already have that on track and we're really excited about it. Doing this with the military, yes. So the VA really has a problem with this. And if I remember correctly, the Department of Health and Human Services said that they really want to modernize the VA health system's administrative workflows in general. So I would love to work with the VA. I think this is a real bottleneck for them. I mean, one of our investors waited 11 months to be credentialed at the VA. He almost just decided he wasn't going to work there, but he was kind of working part-time somewhere and was fine with waiting. But 11 months, it's almost a year of your life waiting to work. And you think about the backlog of people and cases in the OR waiting to be taken care of. So I would love to work with the VA. I would love to work with the military. If anybody has a contact with them, I would love to be connected. Those of you who want to help, want to participate, let me know. This is my email address. I'm available on social media. This is the website. You can always reach out to us through our type form there. And those of you who are investors, you all have my phone number, so you can also text me and call me.